has diabetes type 2, a bunion, hemorrhoids, and vaginismus. Not to mention a puffy eyelid and psoriasis. Next to her is sitting Agnes. Agnes is the same age and is fit as a fiddle. She's trim, she hikes, she's got no health problems at all. What's the difference these two women will pay starting January 1st?
So this is a really good example. Before the Affordable Care Act, these women would have paid drastically different rates for their health insurance. And I would imagine that if we're looking at, what was her name again?
Mildred.
Mildred would likely not have health insurance if she had to buy it on the private market, because she would either be denied or it would be too expensive for her to buy.
So are we saying a pre-existing condition, right?
Correct.
Or multiple
pre-existing conditions, and some chronic. And so the Affordable Care Act sort of levels the playing field, where everyone can buy health insurance based on all the same criteria, which is age, where you live. So there's rating regions, right, which are kind of weedsy, we don't really need to get into, but there are a number of them in the state of California, and they would be in other states as well. And your income, where you, how much money you make, that is what is going to qualify you for certain subsidies and certain assistance from the federal government, and then ultimately what plan you choose. I mean, like I said before, this is about choice. And so if you want to pick a plan that has higher premiums and lower co-payments, that's something you can do. If you want to pick a plan, for instance, if you're 31 and you don't think that you're probably going to have to go to the doctor very often and you kind of want to take a chance, you can buy a plan that has very, very low premiums, and it would cost you more out of pocket if you did get sick or you needed some sort of medical care. So this really allows people to make that decision for themselves.
Harrison with you. You are listening to The Smart Show. We are live streaming on the Progressive Radio Network. We're also on Pacifica, broadcast throughout Los Angeles and Southern California, as well as on our European stations. We're talking about a major new shift in American policy happening January 1st. We're talking to Aaron Fox. Aaron is here in Los Angeles. We're coming to you live from Marilyn Monroe's former apartment. And Aaron has come in to talk about what Obamacare, as it is lovingly or not so lovingly called, really is, also known as the Affordable Care Act, and why at the end of the day it really is a good thing, despite some of the prickly parts that many of us don't love. And I'll just bring one up so we can get this part out of the way and talk about some of the good things. The insurance companies, this third entity that has nothing to do with medicine or patient, called an insurance company that makes billions of dollars, is being handed 29 million new customers. Ding, 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 ding. But because of that, the people like Mildred, whom we mentioned earlier, with multiple maladies can actually be treated. Is that how it works?
Yeah, I mean, that is how it works. And I think that the difference you have now that you didn't have prior to the Affordable Care Act or Obamacare is that insurance companies now have more rules. So any kind of insurance that's purchased through the marketplaces in any of your states, those insurance companies have to offer people 10 essential health benefits. And they cannot discriminate, as we said before, on the basis of pre-existing conditions, on gender, which the insurance companies were doing, and were preventing people from getting care. So at this point, although we still will, many of us will get our health care through buying health insurance, those insurance companies have to be more competitive because the government is essentially deciding they're going to run the marketplace and make sure that things are on a level playing field and competitive. And they're going to have more regulations that they have to abide by. If they want to offer a plan and cover California to people, it has to offer them comprehensive, affordable health care. And this has never really been the case before. And I think it's really good to put this into perspective, because I think one of the arguments is that this is happening too fast. Right? People want to delay this. There have been glitches on the website. And when I look at the fact that Theodore Roosevelt was the first president that advocated for a national health insurance program, this has been happening way too slowly, not too fast.
And remember, it was also Truman, and others after World War II. They knew that after completely decimating Japan, after Hiroshima and Nagasaki, where several 100,000 people were evaporated in a matter of seconds, and then over the next couple of years, as the fallout settled and more people died of cancer, ending up at about 1.5 million or so, that the only way to get a country back on its feet is to have basic medical care. You can't have the infrastructure literally rotting and decaying and think anybody's going to be able to go to work. So first thing they did was provide universal health care to Japan and to Germany, which had had the smithereens bombed out of it as well, knowing that then they could recover and hopefully make nice in the sandbox of the future. It was also attempted here, but then we had basically the rebirth of the American Medical Association, who said, oh no. And what a shift. 2013 or 2014 at the top, it's changing.
Absolutely. I think those are really great points to make, and I think that it's important for our country to understand that in this bill is sort of the spirit of both personal responsibility and community health. We think, that everyone in America should have access to affordable, quality health care. I think we not only have a responsibility to ourselves to be healthy, but to our communities as well. Because as we know, if we look at it from a financial perspective, when people go into the emergency room because they couldn't get care anywhere else, other people are paying for it. So this sort of the individual mandate, the fact that this is sort of collective, that everybody has to be involved in the process, is a really sort of small c conservative idea. And I think that that's also been misconstrued to people.
So what we've got here, Aaron Fox, and Aaron is a specialist with the Affordable Care Act. He's also with the LA Gay and Lesbian Center. And with that, and you having been at the highest levels of government here in the state of California, a very huge state, which when radical change or big change, good change, small change, any change, pocket change, a cigarette change, marijuana change happens here, other people tend to pay vibrant and vital attention. Gay people are considered, at least if in the polls, some 10% of the human population. Same with seagulls and porpoises and other things as well. But let's just talk about the human mammal. Before they have been purposely and vigorously deselected out of the medical pool because of imagined or real illnesses. Does that change for 10% now of the American population?
You know what? It doesn't. Yes, it changes for 10%, but it also changes for a significant amount of other people who are in the same situation, who have historically been marginalized, who have been shut out of the system, the financial system, the healthcare system, and who have sort of been really thrown to the side. And the Affordable Care Act acknowledges that in order for us to be a healthy country, and in order for this law to work, that it is important to acknowledge all communities. Now, I think it's important to also acknowledge that there are a significant amount of communities with health disparities, which are unfair and avoidable. The LGBT community is one of them. We know, for instance, that lesbians on average usually get less mammograms than straight women. We know about the alarming rates of HIV among young gay and bisexual, Latino, and African American men.
Jump in for a second.
Yeah.
Why do lesbians get fewer mammograms than straight women?
When you look at most of the data, I think that there's a couple answers to that question. One, people who've been marginalized historically, whether this be racial, ethnic, or sexual orientation, gender identity, often have had bad experiences in the healthcare system. And so I think one of the fixes sort of built into this is to try and get culturally competent care to the people who need it the most. And then the other reason is because communities who are marginalized often don't seek health care until they're very, very sick. So they don't know where to go. They don't know who to call. They might not have access to the internet. And so these folks who are in these communities don't always access healthcare, and we've seen that historically. So this is going to be a huge opportunity to get those people into the system and to make sure that they stay healthy.
Harrison with you. You are listening to The Smart Show, and you're watching us live on the YouTube channel, Go Harrison, or iNews on YouTube. Simply go to Go Harrison. You can see Aaron Fox. You can see me. Plus, we have graphics up of the various different components of the Affordable Care Act, explaining, giving websites, showing the data, the breakdowns, and everything else. And one of the things, Aaron, as we're about to take some tweets here, people with questions, the first tweet we have, and our Twitter is @GoHarrison, @GoHarrison, one word. First tweet wants to know, what's the cap? Somebody heard there was a cap on the amount of out-of-pocket. Right now, if you have a heart transplant or something, it could cost you, well, let's just say Europeans that come to America are terrified of breaking a leg because it could cost them $200,000-$300,000, and they actually have to pay it back, as do we here. It can put you, as it has so far, 53%. Some 53% of American bankruptcies are from medical situations. Apparently this stops.
Yes, so what will happen is if you buy a insurance plan in one of your marketplaces in your states, there will be a cap on out-of-pocket costs. There will be different cap for an individual, clearly, than a family of four because of the number of people that are on the plan. But before, insurance companies could have both annual caps, which meant or no annual caps, which means you could just keep paying out of pocket. And they could also have lifetime caps, which means if you're 55 and you've had 3 chronic conditions and 3 surgeries and you hit your lifetime cap, well, then the insurance company can just stop paying. The Affordable Care Act changes that.
I love it. We have another tweet here. This comes from Bill in Oklahoma. It says, I'm 34 years old. I'm completely healthy. My roommate is not healthy. We're the same age. We live in the same apartment. You know, do we both pay the same, and roughly how much? I know that's a complicated question, but
no, I think I can address sort of the general feel of the question is the fact that if you are the same age and you have the same income and you live in the same place, depending on what plan you would choose, which varies slightly between the different choices of plans, you would pay the amount that you pay would be almost exactly the same if you were to choose the same plan. So, like I said before, the Affordable Care Act sort of levels the playing field and strips away the fact that if you're sick or you're healthy at the time that you try to get insurance, it does not matter.
One of the big exciting notions here, Aaron Fox, is the notion that insurance companies must now, starting January 1st, pay 80 cents of every dollar, 80 cents of every dollar back to the customer. Oh, my.
Yes, and I'm sure there are some CEOs of insurance companies who aren't quite happy about that, but I'm very glad that it was in law, as it should be. So the premiums that are paid by individuals and by families and the co-payments, those will go to pay for your care. They're not going to be allowed to go for bonuses for CEOs and things that insurance companies have been able to do in the past. I mean, this really is a huge Herculean change that is going to benefit millions and millions of people.
We have a tweet from New York from Tammy in Manhattan, actually in Brooklyn, and she wants to know what questions she's going to have to answer right now. She tried to get insurance through Blue Cross there. They had looks like a 30-page questionnaire about her medical history with ridiculous, intimate questions, probably completely unrelated to her health, it looks like. Is she going to have to go through the same exercise with the Affordable Care Act?
Absolutely not. So when you go onto your state's marketplace website, so you can find that at healthcare.gov. You can look up your own state and find the website for your state marketplace. The only thing that you're going to need at that time is to know your age, your family size, have your social security number, an income statement, and your last tax return. So they're not going to ask you in-depth questions about your medical history or personal questions that you don't feel are appropriate. That all changes with the ACA as well.
And so, in a sense, the only thing I need to provide is how old I am and my address. And the person next to me, literally 4 feet from me, if that person had cancer, for instance, and were going through very expensive chemotherapies and even needed an organ transplant, so long as we had only that person's name and their zip code, he and I would pay the same?
If you had the same plan and you had the same income level and you were the same age in the same rating region, you would essentially pay the same.
Wow. I mean, this is huge stuff. So it really is affordable. It's not just called that because it's a polite term.
No, there's a lot of bills in Washington, D.C. that get named things that they don't deserve to be named. I don't think this is one of those bills. The way that it has been set up is, I think, really ingenious in the sense that it gives people more support who need more support. And it also expands Medi-Cal to lower income people who have never had access to insurance and who have likely had to use the emergency room or community clinics for their health care intermittently. This is going to expand Medi-Cal to a significant amount of the population where states have chosen to expand it and accept the federal dollars. And I think that that's a really big part of the Affordable Care Act that's going to benefit a lot of people.
Harrison with you. You are listening to The Smart Show. We're taking your tweets right now at GoHarrison, and answering questions about the Affordable Care Act. We're being visited right now by Aaron Fox. Aaron is a specialist with the Affordable Care Act and has been trained assiduously as to all the various moving parts and components. Understandably, there are still some changes, some recommendations, some improvements down the road because the thing simply hasn't happened yet fully. Some things have even gotten delayed until 2015. And as we rack up your tweets, so continue at GoHarrison, I'll start to fast fire each of your questions as we get. I want to get like another bunch so I can pull some out that haven't already been asked. Aaron, what's been delayed until 2015?
So one of the things that was delayed was a mandate for certain employers, and you can find more about that on the healthcare.gov website. The effect that it will have is relatively small. It will affect a relatively small number of people, and the federal government made a decision that they weren't ready to move forward with that yet, which I think is wise. If they don't feel they're ready to move forward with the regulation, I don't think it's wise to roll it out. So I think that we will see some changes and we will see some delays. That shouldn't scare people. As we know, forming a law is never perfect. And one of the things that's important is that there are people on the ground, like at my organization, who are doing this work and who are communicating back to both the state and the federal government what we're seeing and how people are reacting. So I do feel like we're getting a really good sense of how this is working for people. And what they would like to see in the future.
We're talking to Aaron Fox. Aaron is here from the LA Gay and Lesbian Center. They are probably the nation's largest service organization that deals with the LGBT community. They've been around for many years. All kinds of people take care of it, like Lily Tomlin and, big, wonderful names, people who care, and a ton of people have been helped and served. And through them, because of their reputation, the federal government has recognized their utility and what they've done and how they help the population, and so have picked them to be able to help enroll people and bring them into this service, because no longer does your gender, does your lifestyle, does your appetite, your opinion, your hairstyle, pre-existing condition, shoe size, penis size, none of that stuff, believe it or not, could have probably mattered before. Pre-existing condition, you have too much blood flow going between your knees. None of that actually matters anymore. And Aaron, if I understand it, women have traditionally had to pay more for health insurance than men.
Yeah, absolutely. Because of the expectation of pregnancy and expectations of certain cancers. This all goes along with sort of pre-existing condition, which clearly gender should not be a pre-existing condition. A woman should not be charged more for health insurance than a man just because she has the ability to have a baby. So the Affordable Care Act acknowledges that. It also acknowledges that people need preventative care, free preventative care, and that has been mandated by the law and will take full effect on January 1st, and people will have ability to get free preventative care screenings for things like cancer, for things like STDs and HIV, and there's a full list at healthcare.gov that's broke down by gender as well for the preventative care services that are going to be available to people that have not been available before.
So what would you say, Aaron, as we look at this thing, and you've been sitting in it for a while and you've had to field a lot of questions, what would you say is the biggest change from what it was 1 year ago to the average person? And I know 3 people right now who have no health insurance, pre-existing conditions, same game applies. Everybody just saw a massive increase in what they're paying. And I think some of us can be paying as low as, ready for this, as low as $3 a month with the affordable health care. Is that a true statement?
Yeah, absolutely. I mean, depending on the plan that you choose, your premiums can be extremely, extremely low. And I mean, I think that the biggest change that this law brings is essentially access, because we have had a significant amount of people, oftentimes who are historically marginalized, discriminated against, who have not had access to health care at all. And have been shut out of the system. And this law will allow those people to buy health insurance for themselves at an affordable rate, so that everyone is essentially involved in the system, so that there aren't people feeling like they're paying for other people's health care. The aim of this law is for everyone to pay for their own, and for those who can't, the federal government will step in and help them do that.
Heather in New Jersey wants to know about her teeth. She seems to feel,
good question.
Unlike today, where we all know your teeth and your eyeballs are not actually part of the human body, and therefore they're not covered. She seems to think her teeth, her beautiful, glistening, pearly white, beautiful bicuspids, actually are affixed to her physical body, and wants to know, will they be taken care of too?
Well, 1, I agree with her, and 2, I would direct her to her state's marketplace website, because each state, especially if they're running their own marketplace like California is, has the ability to offer different types of plans. So in California, it looks that we'll probably have a standalone dental plan. I would imagine some other states will probably do that. So you might have to purchase a standalone dental plan, which means it wouldn't be enveloped into your overall large health insurance plan. So for people like now, for instance, my dental insurance is through a company that is not the same as my entire medical insurance is through. So it would definitely depend on the state what they're going to offer. That definitely is a difference.
We're talking to Aaron Fox. Aaron is with the LA Gay and Lesbian Center. He's also a trained specialist in the Affordable Care Act. He and his service are going to be enrolling people here in California. We're broadcasting to you live from Marilyn Monroe's former apartment. Harrison with you. It is 32 minutes past the hour. You are listening to The Smart Show. You can like us on Facebook. Keyword My Harrison, and we'll be able to put together more trips for you, as we did just a couple of months ago, sending a couple of you off to Switzerland for a little first-class treatment, 5-star hotel, airfare included. We're going to be putting more of those together, so simply go to Facebook and like us, keyword My Harrison, or Carrie Harrison, or any variation you find in there. Probably Go Harrison works as well. Go Harrison, of course, being the keyword right now on Twitter, where you can tweet your questions. We have another one. Roger in Miami is pleased to know that Heather's teeth will be taken care of, but he seems to think that his eyeballs, which currently, before the Affordable Health Care Act kicks in, his eyeballs are not part of his physical body. Will his eyeballs be included?
So, essentially this is the same as sort of the dental plan, is marketplaces will have the opportunity to roll out those plans. I would imagine that there's likely to be a standalone dental and a standalone vision. That's a guess, so don't quote me on that. But you will have to look at your state's marketplace website to see what plans they're going to offer for both dental and vision. They're not essential health benefits and the 10 essential health benefits that have to be offered through the overall health insurance plans, but I think that we can all acknowledge that our teeth and our eyes are part of our bodies, and we do need medical insurance that is going to cover those parts of our bodies as well. So I think looking at your state marketplace is the way to go to find out what's offered in your state specifically.
Harrison with you. This is The Smart Show. We are talking to Aaron Fox. You know, one of the reasons for having any kind of universal health care, as we looked at World War II just moments ago and talked about the Japanese and the Germans after their economies and their civil population and combative population, both decimated completely, people walking around the streets hunting for food, that if they didn't have basic medical care, they could not rebuild themselves into any useful society. Likewise, it seems, despite the drones, despite the endless litany of displeasures we may have about this current president, if this is his one positive legacy, it's certainly quite huge. And here's just a practical example. You take Beverly Hills, which is right next door from us, right? Beverly Hills, and we have somebody with a lawnman, a Mexican gardener in there, leaf blowing, cleaning up, etc. And that person may not want that Mexican gardener to have any kind of health care that the Beverly Hills resident would have to pay for. That Mexican gardener happens to get bird flu or swine flu or H1N1 or syphilis or something, and is walking around, and out comes little daughter to fetch the mail from the mailbox. Let's say the gardener has a communicable disease, coughs, the wind blows it across the little girl getting the mail, she walks back inside, and all the white folks suddenly have the disease. It's a mystery. Nobody knew how it spread throughout all of Beverly Hills, but because we don't actually look at medicine as viruses, as common colds, as flus, as something that simply mammals get, but somehow some people are special and some are not, I think we learn through this system, through medical care, just keeping an eye on it as you have, Aaron Fox, that if you breathe and have cells that divide, you're vulnerable.
Yeah, absolutely. And I think this is one of the key tenets of why there's an individual mandate, so that everyone who is eligible knows that they're responsible for taking care of themselves and the community as a whole. And I think that that's sort of a new idea for some people, that they might be responsible to their community as well. I think as far as the LGBT community goes, we had HIV and AIDS to learn this from, which a lot of other communities didn't. And so I think that, you know, going through that experience, realizing that we need to make sure that people have health care, especially when it comes to chronic conditions that are infectious chronic conditions, by us allowing people to get into health care and receive preventative care and treatment, it's going to cost us less in the long run, both in quality of life. It'll increase quality of life, and it'll cost us less in the long run because we'll be treating conditions sooner rather than letting them get really, really bad to the point that people have to go on disability or they're not able to work and they can't contribute.
Are you suggesting, Aaron Fox, that preventive medicine will be included in here? The dreaded preventive medicine? Dreaded?
Absolutely. I mean, absolutely. I think one of the tenets of this law is that this is not sick care. This is going to be heavily focused on preventative medicine, which most all of the preventative screenings are completely free to people. And as I said, you can look those up on healthcare.gov. And so this is taking a really, really big step forward and saying we need to make sure that we are fostering healthy environments for people to live in so they don't get sick later. And I think that that's a really good way of looking at things. You know, an ounce of prevention is worth a pound of cure.
Yeah, even though the great Margaret Thatcher of England, back when King Ronald I had ascended his throne here in the United States, pointed out that communities are bad, individuals and families are good, and that there is no such thing as community, only individuals and family, and individuals have the right not to be equal. This kind of throws that aside, because now that we've enjoyed 30 years of that thinking, and we do have just rack and ruin left and right, this is going to restore us to a functioning plebiscite where all of us know that neither of us is going to be walking around giving anybody a disease, because it's actually fixable before it gets out of control, as you so rightly point out. Let's go to another tweet. We have Casey wants to know, why should a young, healthy person do this?
That is a great question, and I'll use myself as an example. I ended up having a surprising surgery when I was 27 years old. Would have never expected to have a surgery. Luckily, I had health insurance through my employer who paid for it. But when I saw the statements come from the hospital about how much my very small outpatient surgery had costed, if I didn't have health care, I would be in a significant amount of debt right now. So it's a gamble. So if you're 27 or and you're healthy, you will have to buy health insurance. You can buy, if you're under 30, a catastrophic plan. You could buy a smaller plan that has lower premiums, so you don't think you're going to use the doctor that often. But again, it's a gamble. You could walk off the street, in an hour and get swiped by a car and have to be rushed to the emergency room, and you'd be on the hook for that debt. And we know that healthcare debt is getting to a point in our country where it is bankrupting people, and this will hopefully stem that tide.
And that's the key, is to make sure that we can staunch the bleeding before it starts, right?
Exactly.
We are taking your tweets at GoHarrison, We're also live streaming right now on YouTube, keyword GoHarrison channel on YouTube, live streaming where you can see Aaron and also see a breakdown of what the Affordable Care Act is, because for some reason, non-ubiquitously, is the information about what it really is and what it can do for you and how to actually engage in it. What is ubiquitous is why it's horrible, why the government has been shut down because of it, all this being an enormous red herring, even a double MacGuffin if you think about it, because at the end game it's about privatizing parks and lands and everything else. Another issue, Section 8 stuff that's been going on with HUD. We can get into that in a different show at a different time. But right now, we're lucky to have Aaron Fox with us. He's with the LA Gay and Lesbian Center, also an expert, well-trained on the Affordable Care Act, able to answer your questions in, as you see, really great and competent detail. Let's go to another tweet. Rachel wants to know, why is there such a difference in prices in the marketplace between insurance companies? And she's asking that from Wisconsin.
So it really depends on what plans you're looking at. So there's essentially 4 different tiers, what they're called metal tiers of plans. There's bronze, silver, gold, and platinum. And if you want, for instance, a bronze plan, which is going to be very low on premiums, but very high on out-of-pocket costs, that would be someone who, like our previous tweeter, thought that she probably didn't really need that much health insurance because she was pretty healthy. For someone that knows that they maybe have a chronic condition and is going to be utilizing their health care very frequently, they might want to pay a higher premium and then have to pay lower out-of-pocket costs because they know that they're going to utilize their health care more. So this really has to be a personal choice, and that's why there's differences in the plans, because some people might want to choose a plan that better suits their life, or they feel better suits their life. Other people might want to choose a plan that better suits theirs. That's why the differences exist.
So what we've got is a spectrum. So if you want to pay a really low rate of $2, $3, $4 a month, or $19, your premium is going to be a bit higher, or maybe significantly higher, possibly matching what things are like today. But you don't go to prison for racking up $900,000 worth of bills. So if you're a regular person and you get 48 heart transplants, 62 liver transplants, and permanent dialysis, throw in an iron lung and the rest of it, right now a doctor will say, I really recommend this, and the insurance company will say, that's an experimental procedure. Forget it. And we know by a guy named the Berlin patient who was in Germany at the time, though he was American from San Francisco originally, was in Berlin and used the German medical system, which is universal health care. Because he had universal health care, there's no such thing as a pre-existing or experimental procedure, and they actually cured his AIDS because it was a medical procedure. Does that mean that we might see behavior closer to that in this country?
I mean, I think we're taking steps towards getting there. I think that when we roll this out, you're going to see people who have never had access to any kind of health insurance or comprehensive coverage gain access to that. So I think that's really, really the focus of the Affordable Care Act. And although there are always special cases with medical care and with complications from multiple chronic diseases, I think that the sort of average person who's out there right now can take a look at this and really see that this is going to benefit them in a way that is just going to make their life better. And they're not going to have to live in fear that if they get sick, they're going to have to run up a huge mountain of debt because they had to go to the emergency room. So I think that's what's really key to focus on.
And so what we're looking at is, of course, the Affordable Health Care Act. We're taking your tweets right now at GoHarrison, and answering any questions we can through Aaron Fox, a health policy manager who's been trained not only by the government in the Affordable Care Act, which is law, has been passed, and has nothing to do with the government shutdown at all, but is being used as a political football in order to achieve an entirely different end, which is, well, it has nothing to do with it. It's, if you look at the European press, not the American, in this way we can just take a different angle, they believe that a very, very extreme right-wing side of the Republican Party has taken over and has pulled the plug on the operation of the federal government. Does that mean the Affordable Health Care Act gets damaged by this or suddenly becomes unlaw, Aaron? Or can people feel confident that if they're early enrolling right now on a website that they're going to be taken care of after all?
Yeah, that's a great question. I think that there have been a lot of misinformation about the Affordable Care Act. So one, the simple answer is no. The Affordable Care Act is moving forward regardless of the government shutdown because the money to pay for the Affordable Care Act and its implementation has already been approved and appropriated by Congress and is moving through the government system to make sure that it happens. So when people hear that the House has repealed the Affordable Care Act 40 times, the Affordable Care Act has never actually been repealed. The law has never been repealed. So it will continue, and people will have the opportunity, specifically here in California, if they enroll by December 15th, their benefits will go into effect January 1st, but open enrollment lasts till March 2014. Those times, from my understanding, will not change. Even if this government shutdown does last longer, which I think that it probably won't last too much longer, the Affordable Care Act will be there for people who need it.
We have another tweet. This one comes from Sam in Texas. Sam wants to know, I don't want to have Obamacare. I don't want it. I think it's communist. I think he's a communist. Actually, it says terrorist. Sorry. I think he's a terrorist. I don't want to be forced to have Obamacare. Do I have to have it anyway?
If you do not have health insurance, there will be a tax penalty that increases after the first year of implementation. If you have health insurance, for instance, through an employer, through Medicare, through Medi-Cal, you have a private plan, there will be no penalty. So if you currently have insurance that you're happy with, this will not change for you. So I want to make that clear to this specific person, because if you have health insurance that you're happy with, nothing will change. You do not have to avail yourself to the marketplace that will exist in Texas.
We have a tweet from Ashley in San Francisco, here in California, says that she is transgender and looking to have greater surgery, but it's been impossible for her to get health insurance, and she's been relying on public donations and things of this nature, and her life, it looks to be very complicated and impossible medically. Does she have a chance of actually having a secure medical future?
Yes, and California has really been out in the lead on making sure that transgender individuals and their needs are supported through this process. And plans that will be offered in Covered California, which you can find at coveredca.com, will provide transgender health care benefits. It is law in the state of California. If you're in a different state, that might be different for you. As you know, California tends to lead the way, and I hope other states would follow when making sure that folks that are in the transgender community have the access to health care that they need.
Harrison with you. You are listening to The Smart Show. We are on the Pacifica Radio Network, all the way up and down the state of California on the Progressive Radio Network, plus our European stations. And we're talking about the Affordable Care Act. We're talking about what is commonly known as Obamacare, a name that it looks like Aaron does not like that name. It's not my favorite name either. But I do like the Affordable Care Act because we have just learned it actually makes it affordable. And it does not bankrupt the country in order to do it. It's basically a big group policy, and the insurance companies still get to get rich. So what's not to love about that, right? Cynicism aside. Speaking of Europeans, we have a tweet here from Europe, from Denmark, saying, what if you're American and you move overseas halfway through 2014? What happens to your Obamacare?
That's a really great question. And if you changed your residency, you would have to look at getting healthcare coverage. For instance, if you change your citizenship to move to another country, that would definitely affect your ability to get a health insurance plan through one of the marketplaces. But if you have a really, really specific situation that you feel is sort of more complex financially, if you're an independent contractor, if you don't know how much money you're going to make next year or you made last year, for instance, if you're a server and you have to estimate that. The thing that's great about this law is that it allows you to either call a call center or meet with someone in person to go over all of this. And there will be certified enrollment counselors who will be able to sort of deal with more of these complex issues about residency, about changing if you move to a different state. Those things all have an impact on that. But know that whatever state you are in, at least in the United States, you'll be able to get coverage.
Harrison with you. This is The Smart Show. We are live streaming on our YouTube channel. Keyword Go Harrison, keyword Go Harrison. We can see Aaron Fox and a visual breakdown of many of the implemented policies that are imminent in the fully functioning version of the Affordable Care Act. Aaron comes to us from the LA Gay and Lesbian Center, the largest such provider in the entire world, we think at this point, certainly the oldest, and they're massive. And so they've been handpicked by the government to handle this region, Southern California, and help enroll people and help explain Lucy what this thing really is, that it's not the big boogeyman that it has appeared, certainly politically as it appears. We're finding out it's a rather good thing. Some of the small icky parts are really minor compared to the good work that it's actually going to do and help everybody. If you're in Flint, Michigan and you got laid off, you're good, no matter who you are. Here's a tweet coming from Denver, Colorado. Wants to know, I'm very poor. I could sign up for a 3-month plan. That's about all I could afford. What happens to me then?
I wouldn't need to know specifically sort of where you're at income-wise, but if you're very poor and your state will be expanding Medi-Cal, if you make under approximately, it's about $15,600, if you're making under that, you would qualify for Medi-Cal if your state decided to expand Medi-Cal. If you were above that threshold, and you wanted to buy a plan in Covered California, the government would, depending on your eligibility, be able to assist you with paying your premiums and would also, if you're eligible, assist you with paying your out-of-pocket costs, so your deductible when you go to the doctor. So for those in more need, there definitely is support. And I just want to make sort of one point. We're talking about this in a very universal way, and it is a universal law in the sense that you have to be a lawful citizen to access this law and to access the benefits that come from it. It does not include undocumented individuals who we know are still people who still need health care. I think an active, well-funded safety net is really important to continue in light that this law does not cover everyone who lives in this country.
So they're going to be forced to do what they've routinely done, which is what actually documented people do, or just born natively here, as I was, my family, 1640. But when times are hard, maybe it's off to Cedars-Sinai or some big old hospital because you won't have a choice. So undocumented people will continue to do what they have done in the past, but I'm guessing all of this will end up shaking out the cost a little bit, dollar cost averaging, and making it a little less painful at the end of the day for the taxpayer. At least that's what we hope, right?
Absolutely. And I think, our community clinic network, things, like our Ryan White program and emergency Medi-Cal, those are all things that are still going to be there for people who cannot get health insurance through the Affordable Care Act.
Well, I want to thank you so much. We've been talking to Aaron Fox. He is a health policy manager. He has been trained in the Affordable Care Act. Admittedly, we don't know how this thing is really going to end up. I'm going to use a Rumsfeldism or Rumsfeldian bit of logic and inverted syllogism here. That does sound sexual, doesn't it?
Yeah.
But Rumsfeld used to talk about the unknown unknowns, and then there were the known knowns and the unknown. What are some of the unknown unknowns with the Affordable Care Act?
Well, I think whenever we go through sort of a really big change where we're offering people a new opportunity that they've never been offered before, I think one of the big unknowns is, how many people are going to enroll during open enrollment period, which I talked about, how many people, once they actually have the insurance, are going to use it, right? Just because you have health insurance doesn't always mean you use it. And I think that that's sort of more of a systemic problem we have as Americans who oftentimes don't want to go to the doctor. And I think so, just because people have access doesn't mean they'll utilize it. And so I think it's going to be really interesting to see how people respond to this. So that's one of the big unknowns, and I think it's one of the ones I'm looking forward to seeing. And I think that we're trying to do our best at getting the word out to people about this and dispel myths. And it is a little complex. It is, and people shouldn't be fearful or feel overwhelmed. If they do, that's fine. This is sort of a big overhaul of what we're looking at and the way that health insurance works in our country. And so I think there will be people in your community to answer these questions that you have.
And when we look at standard of living in the world, and we look at the Swiss and the Scandinavians and the rest, we do not consider them layabouts or slobs. We really love to imitate them. We just can't stand the notion that we have to share our toys. But they do it, and they're healthy and fit and lively. So what's not to love about that? Let's see how this turns out. Aaron Fox, I want to thank you so much for having joined us here on The Smart Show. Thank you for putting yourself also, I think, in a vulnerable position, because not everyone is a big fan of this. But once they hear your voice, I think it really brings them around, because it just ain't that complicated. And helping others, well, I believe Jesus said that was a good idea.
Thank you.
I may be wrong. Thank you. Harris with you. This is The Smart Show. Hang on. Gary Knoll is coming up next, and we will see you next week. You can get an archive of this simply by going to goharrison.com. There's an archive on that and everything else. Have a great week. Look forward to seeing you later. Bye. All right, we're down.
Cool. Is that okay?
Good, clean fun.
Any kind of insurance that's purchased through the marketplaces in any of your states, those insurance companies have to offer people 10 essential health benefits, and they cannot discriminate, as we said before, on the basis of pre-existing conditions, on gender, which the insurance companies were doing, and were preventing people from getting care. So at this point, although we still will, many of us will get our health care, through buying health insurance, those insurance companies have to be more competitive because the government is essentially deciding they're going to run the marketplace and make sure that things are on a level playing field and competitive. And they're going to have more regulations that they have to abide by. If they want to offer a plan and cover California to people, it has to offer them comprehensive, affordable health care. And this has never really been the case before. And I think it's really good to put this into perspective, because I think one of the arguments is that this is happening too fast. Right? People want to delay this. There have been glitches on the website. And when I look at the fact that theater
stations, we're talking about a major new shift in American policy happening January 1st. We're talking to Aaron Fox. Aaron is here in Los Angeles. We're coming to you live from Marilyn Monroe's former apartment. And Aaron has come in to talk about what Obamacare, as it is lovingly or not so lovingly called, really is, also known as the Affordable Care Act, and why at the end of the day it really is a good thing, despite some of the prickly parts that many of us don't love. And I'll just bring one up so we can get this part out of the way and talk about some of the good things. The insurance companies, this third entity that has nothing to do with medicine or patient, called an insurance company that makes billions of dollars, is being handed 29 million new customers. Ding, 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 ding. But because of that, the people like Mildred, whom we mentioned earlier, with multiple maladies can actually be treated. Is that how it works?
Yeah, I mean, that is how it works. And I think that the difference you have now that you didn't have prior to the Affordable Care Act or Obamacare is that insurance companies now have more rules. So Roosevelt was the first president that advocated for a national health insurance program. Yeah. This has been happening way too slowly, not too fast.
And remember, it was also Truman and others after World War II. They knew that after completely decimating Japan, after Hiroshima and Nagasaki, where several 100,000 people were evaporated in a matter of seconds, and then over the next couple of years, as the fallout settled and more people died of cancer, ending up at about 1.5 million or so, that the only way to get a country back on its feet is to have basic medical care. You can't have the infrastructure literally rotting and decaying and think anybody's going to be able to go to work. So first thing they did was provide universal health care to Japan and to Germany, which it had the smithereens bombed out of it as well, knowing that then they could recover and hopefully make nice in the sandbox of the future. It was also attempted here, but then we had basically the rebirth of the American Medical Association, who said, oh,
insurance based on all the same criteria, which is age, where you live, so there's rating regions, right, which are kind of weedsy, we don't really need to get into, but there are a number of them in the state of California, and they would be in other states as well. And your income, where you, how much money you make, that is what is going to qualify you for certain subsidies and certain assistance from the federal government, and then ultimately what plan you choose. I mean, like I said before, this is about choice. And so if you want to pick a plan that has higher premiums and lower co-payments, that's something you can do. If you want to pick a plan, for instance, if you're 31 and you don't think that you're probably going to have to go to the doctor very often and you kind of want to take a chance, you can buy a plan that has very, very low premiums, and it would cost you more out of pocket if you did get sick or you needed some sort of medical care. So this really allows people to make that decision for themselves.
Harrison with you. You are listening to The Smart Show. We are live streaming on the Progressive Radio Network. We're also on Pacifica, broadcast throughout Los Angeles and Southern California, as well as on our European as diabetes type 2, a bunion, hemorrhoids, and vaginismus. Not to mention a puffy eyelid and psoriasis. Next to her is sitting Agnes. Agnes is the same age and as fit as a fiddle. She's trim, she hikes, she's got no health problems at all. What's the difference these two women will pay starting January 1st?
So this is a really good example. Before the Affordable Care Act, these women would have paid drastically different rates for their health insurance. And I would imagine that if we're looking at, what was her name again?
Mildred.
Mildred would likely not have health insurance if she had to buy it on the private market, because she would either be denied or it would be too expensive for her to buy.
So are we saying a pre-existing condition, right?
Correct.
Or multiple
Pre-existing conditions, and some chronic. And so the Affordable Care Act sort of levels the playing field, where everyone can buy health insurance